Hey, what's up guys? It's Ben with Clinical Marker here to talk to you guys about seamlessly transitioning patients to your signature continuity program. All right, so where I see the biggest mistake is people not beginning with the end in mind. The common mistake is also patients hearing about this for the first time on their last visit. When this happens, they're kind of blindsided. They might be coming into their last session excited, like, hey, I'm graduating PT today. I'm super excited. This is awesome. And then they get kind of hit with something they haven't even heard about before. You're in turn going to get hit with a lot of, I need to think about it. Can I talk to my spouse? Stuff like that. Because again, they haven't had any time to even process this, even know this was a thing. And they went into that last session thinking it was their last session. So it's going to decrease your conversion rate significantly if the first time they're hearing about it is on their last visit or towards their end of the plan of care. So you need to begin with the end in mind. So what do I mean by that, and how can you implement those exact things? So you need to have multiple touch points. And this should happen at the very, very beginning of their relationship with you. Okay, this should be also featured on your website, okay, and also discussed on that first phone call. I also like discussing it with patients on their first phone call because it's also going to increase your conversion rate. A lot of people are really excited about this at the end of their call with us, and it really sets us apart from other clinics in the area. And it also kind of has some building more credibility and social proof of the results that you get for patients. When you state, hey, we have a 3-step process. The third process is getting you back to being bulletproof, and then the last phase is we do have you can name it whatever you want, like we discussed in the previous training here, but discussing our continuity program, be like, hey, a lot of our patients, when they're done working with us on a formal basis for physical therapy, they're like, holy crap, this is awesome. I have a body that I didn't know was possible, and I'd like to kind of push it at the envelope and see what is actually possible. So we let them know, like, our goal isn't just to get you back to where it was, because that's how you sustain the injury in the first place. We want to help you guys level up and be able to do things that you never thought were possible. And then a lot of times we will tell a story of like a runner, for example, that just wanted to get back to running 1 to 2 miles pain-free, and they got to their end of their plan of care with us, and they were back to running 5 miles. And like, holy crap, I obviously need to level up my goals, and I'd love to be able to do a half marathon. I just didn't think it was possible at this point. So we tell them they're working with us currently right now for training purposes, prepare for this half marathon they have in 3 months. Making sure they stay injury-free and also improve their time and their performance with it too. So that can be really, really powerful on that first phone call. We also discuss this at the evaluation when we're going through the Mountain Dew More and getting to the top of Mountain Dew More. We discuss this. And I want to preface by saying we are not asking for commitment on this at any of these steps, these first few steps. Here, we just want this to be something that they're hearing over and over again. So when it gets to the end of the plan of care, this isn't something that they're just hearing for the first time or completely surprised about. Okay. We also like to include, people really resonate with stories. That's why I just mentioned, like, we discussed that story on that first phone call and discuss this during follow-up sessions as well. So a lot of times patients will be like, how was your day? Stuff like that. And you can tell a story, be like, awesome. We actually have somebody that's coming in, someone similar just like you, who was going through X, Y, and Z, and they're working on our bulletproof runner program now that they're done with PT, and they just got done completing their first half marathon pain-free. They're now training with me for the next 6 months, and they're going to aim for a marathon or something like that, right? And so again, just kind of putting that in their ear and telling a story so they can resonate with that. So you can interject patient stories, usually 3rd visit, 4th visit, 5th visit, somewhere around there, okay? Just don't want to go from the evaluation, then hearing about it, those first 3 steps, and then not hearing again, 6, 7, 8 weeks later on their 7th or 8th visit, where we also discuss this next step here, and that is discussing on helping them level up their goals. Usually during the 7th or 8th visit, like, I'm assuming this is like a 10-pack or a 10-visit plan of care. That's the assumption. You guys can change this up based on the plan of care, but for numbers purposes and simplicity purposes, we're just assuming that's a 10-visit package with the example I'm going over here today. If a 10-visit package, usually on the 7th or 8th visit, we're kind of reflecting on how well they've done and the progress they've made. And a lot of times they've already met a lot of their main original goals by this 7th or 8th visit, or even before this. So like, hey, you came in and you were just wanting to get back to running 1 or 2 miles. And that seemed like a daunting task because you'd been dealing with this injury for a year or more. And now you can see that your body does have the capacity to be able to tolerate running. If I could snap my fingers and give you the confidence in the body that you need to be able to do anything, a race or what have you, do you have any other goals in mind that you'd like to aim for? Right? And so we just try and kind of put this in the ear to at least have them start thinking about it, and that is part of their homework. So when they come into their next visit on the 8th or 9th visit, their homework was to come back with a level up goal that they would like to accomplish, like their big overarching goal that's leveled up since their evaluation, because they're much further along and can kind of think a little bit bigger because they're not just kind of more closed-minded because of the acute injury anymore. okay, and made a lot of progress and kind of they're starting to see what their body's actually capable of. When they come in on that 9th or 10th visit, this is where we really start. Now that we've got that big overarching goal, we discuss and give them our signature continuity program and tailored exactly to them and what they're looking for and what they're needing. You got a couple different options of continuity. You can use like a pricing sheet and a breakdown of it for them to visualize, if you're doing remote programming, or depending on how your continuity program is split up. If you got multiple options, you can use a pricing sheet or an option sheet for them to help visualize as well. As you guys also implement this, you want to analyze and refine. You might realize that, hey, I'm kind of forgetting to do this on the first phone call, or I'm forgetting to do it on the evaluation, and just really focus on getting all these steps down and discussing with them at each of these steps. So they're hearing it multiple times before you even bring up asking for commitment in that continuity program. And so a lot of times they come into that 9th visit already planning on wanting to continue on at some capacity to help accomplish this overarching goal that they have. So hope you guys found this helpful, and let me know if you guys have any questions.